So next up, we have Joan, who is the CEO and founder of Several Seats. Several Seats is a female-led community that aims to promote mental health in women of color and for women from ethnic minority backgrounds. She'll be discussing the lack of representation in the healthcare sector. So Joan, hi.
Hi, thank you so much for having me today. I'm super excited to be with you lovely ladies. So I'm going to dive in and basically give you a bit more background about myself. So I myself work as an assistant research psychologist for young epilepsy in Great Ormond Street Hospital. And I've worked within the NHS for about 5 years now. I used to work for the East London NHS Foundation Trust, and it's been an experience of ups and downs and a whirlwind of emotions, as well as me identifying who I was and feeling comfortable with my own identity as a Black woman in the healthcare service. From my personal experience, especially in psychology, the ratio has very much favoured women. There's always been 90% women in my course when I did my undergrad, when I did my master's, and then a small percentage of men, and an even smaller percentage of women from ethnic minority backgrounds. As you see this trajectory continue, there seems to be a flip. You start to see more men in executive directing leadership roles and board of trustees, and then you start to see a very small proportion of women. What you'd find surprising is that there's actually a percentage of 70% of women make up the health and social care workforce, but yet only 30% of leaders in the global health sector are actually women. In the UK, Black and ethnic minority women are disproportionately underrepresented at senior levels. There's a crucial leadership gap that is caused by occupational segregation, essentially. Now, I did a bit more research into this, and I looked at a survey completed by the NHS Policy Advisor Research Analysis. And in 2019, there were 7.5% of executive directors in trust within the NHS who were actually Black and ethnic minority, belonging to Black and ethnic minority groups. And if to give you guys a bit more scope of what that looks like, that's 81 people out of 1,077. That's a huge gap that needs to be filled. Now, since 2020, that number of 7.5 has increased to 11.8. So great, we're doing a great job. We see that the numbers are going up, but it's not going up quick enough. And you can see that there are still that proportion of 70 women in the actual healthcare sector working as nurses, psychologists, social care workers, all these amazing on-the-ground work. Essentially, the trenches, they're working at the front line, aren't they, essentially? But then when we see, as you go up in the executive boards, in the directors, it still leaves us at only a 30% ratio. So there needs to be change. So why is this? Prejudice results in women being placed at a disadvantage not merited by their conduct. Now, what needs to happen? Long-term structured change. There needs to be a shift. And I've stepped it into three kind of sections. So first, there needs to be social identity unfreezing. I mean this by saying there needs to be an attachment. There's currently an attachment to current stereotypes. What a leader looks like, how a leader acts, their personality, their gender, their race, their ethnicity, their culture. And this needs to be unfreezed and detached, completely removed, discombobulated and thrown in the bin. Step two, social identity moving. There needs to be a shift. We need to start to reframe pre-existing political ideas that have been perpetuated through old ideologies about what a leader looks like, who a CEO can be, the ideal representation of a board of directors. This needs to completely be moved, shaped and reformed. There needs to be new policies placed into practice within the healthcare sector, both private and public. And then the third one is social identity freezing. This is essentially once there's been a shift and everything's been changed, we need to start committing to the change itself. Change doesn't happen overnight, and it needs to be a case where we don't see there's an increase of women in 2023 or 2022 as we are in now. And then come 2024, we start to see it go back down. No, that's not happening. We need to commit to change and solidify that change and make sure this is a long-lasting thing that starts to take place. How to do this practically? I would say raising awareness. So things like these amazing organizations where we have these conversations that need to be had, and there needs to be more light to it. Because essentially, sometimes it is a level of ignorance that people don't actually realize that everyone on your board is white men. Specialist recruitment. There needs to be recruitment that takes place where we give an actual opportunity to the women who would be great for these jobs. Because a lot of the times, and I speak from this, like I said, I've worked for the NHS for 5 years now. And I think I've only received one email, which was actually last week, about the opportunity to join the board of trustees. And essentially that should have been something that was put into place anyway. There should be newsletters going out to the nurses, the women at the front line, the psychologists, the social care workers, about amazing opportunities taking place in the NHS for them to join in their recruitment process. Because essentially it's not reaching those demographic of people. Mentoring and sponsorship programs. We at Several Seats actually run a mentorship program that promotes the learning and upscaling of women from minority backgrounds, pursuing careers as mental health professionals in the NHS. And what happens is you have people who are either in the NHS already or graduates who've completed psychology degrees, nursing degrees, and they help mentor women who are trying to get their foot through the door and give them essential skills, how to find their self-worth, managing imposter syndrome, diversity and inclusion within the workplace, progression in careers, and so much more. And it needs to be more of these kind of things taking place where women can get the opportunity to get that essential skills that will help them in going into the workplace. And the last and final point that I have is develop ability to lean into conflict. Now, when I say this, I mean having uncomfortable conversations. There is an issue. Let's address the elephant in the room and start to lean towards having these conversations rather than steering away from them. These statistics are out there, but they're never published in news articles by the NHS. They're never shown because essentially it looks bad. But in us leaning towards the conflict, we can start to address it and go back to those steps of unfreezing, moving and freezing and changing the way that the NHS currently is structured. And I hope that today everyone could just take a little nugget from what I've said and join us in this movement that we're currently trying to gain. So thank you so much again for having me. I'll hand back over to Hayley.
Joan, tell us, how can we help you? What can each of us do here to support you, to support the work of Several Seats?
Join our newsletter, subscribe to our newsletter, and then when we're having the next cohort of ladies for the mentorship scheme open up in May for applications. Share with your cohort, share with the women in your community, let them know that we're doing this for people who are, like I said, professionals already in the NHS or in the private or public health sector. Get them to join as mentors, and those who are young ladies aspiring to become professionals, or even those who are already working in the NHS, but they want to start to move in their career progression to become executive board directors, trustees, get them to come on board as mentees and also learn from those who are already in that area. There's so much space for learning. There's so much space for peer-to-peer support and growth. And I believe that with this kind of program and the things that are already going on in the communities, and there can be so much growth and yes, just all the learning that can be taking place. So thank you very much, Lauren.
Awesome. I've put some links in the chat for you there, so you can connect with Joan on LinkedIn, follow Several Seats on Instagram. Through there, you'll get links to sign up to their newsletter and connect with a lot of the stuff that Joan just shared. Awesome.
Right, cool. I think peer-to-peer support is really key, and everything that you was talking about, that's what I took away, the learning and just the growing from it into making the real change. So thank you for that, Joan.